Hi, I'm here with Api today. Api, you've spoken this morning at one of our breakfast sessions at the Goodfellow Symposium, and you've painted a pretty sad picture about the state of health of Pacific peoples in Aotearoa. Can you tell us a bit more about it?
Sure. It is quite sad. What I wanted to share is that we've got a good health system in New Zealand, very first world, but not all people in New Zealand enjoy the same level of health care or the health outcomes. The evidence or the incidence of chronic illnesses with Pacific patients is sad, and it's getting worse. You know, diabetes, blood pressure problems, heart disease, and it's not just the individual illnesses, it's the comorbidities that come with it. And we, GPs, all health workers need to do things in a different way if we're going to combat this epidemic.
You talked about some research this morning. Can you tell us some more about what that has been involved?
Yeah, so the research is really interesting about Pacific people's experiences with primary care, and their positives and negatives. The negatives was they felt sometimes rushed through the consultation. There wasn't, there was issues with communication, not just language, but the understanding of the advice that was given. And, you know, not giving excuses, but you can understand as a GP in a 15-minute slot, how do you explain the complexity of the new diagnosis of diabetes to a man who has a lower level of education, perhaps unemployed, who has no control about who does the cooking and the shopping at home. The good things are Pacific people really respect their general practitioners. They want to be involved in their healthcare, but they sometimes feel they're not given the opportunity to engage with the GP.
So what can we do differently? How can we develop that relationship that's so important?
Yeah, so, and that's the other good thing about the research and the evidence out there, that Pacific people are really responsive. They want the best for themselves and their family. So when you see that person sitting in front of you, it's really important for us as clinicians to think about the unit that they represent. They're part of a family, perhaps even an extended family, that impacts on their health because the resources they can get access to are shared amongst the family. So involving the family in their health, in the health advice that is given. We know, for example, from immunization campaigns that if we talk to the community health worker, or maybe even the Samoan or the Tongan nurse, or engaging the church minister, that lifts the literacy levels of understanding the importance of this particular aspect of their health.
It's having on our radar that we need to be looking beyond the person who's in front of us and what else is involved in their lives.
That's absolutely right. And you won't get it in the first consultation or second, maybe even third. But if you start to build that relationship, that you want to understand, you appreciate that here is this person who is keen to understand, to do things to improve their health, but that you want to engage with him or her and their family, and you understand them being part of a unit, that starts to build a relationship that's going to be lifelong.
So Api, what can people do from next week? You know, what can they take home and start doing straight away in their consults, you know, from what you've given us today?
Very, very simple things that we can do is just having an open mind to a Samoan or a Tongan or Niuean person sitting in front of you and saying, hey, I know that this might be difficult for me to express to you. Is there someone else at home that could come with you next time that might be able to assist? Because, you know, I put it on myself. I say, sometimes I don't hear everything that has been spoken. Maybe it's easier if you come in with someone else, maybe your wife, maybe your daughter, so I can help. Just showing your appreciation that you understand they're part of a unit, they're not just the one individual, will really help them appreciate your advice. And I think we as GPs need to think about the quality of our advice and just add to that. It's not a simple, symptom, sore throat,
This is what
write
you
a
do.
prescription, this is what you do. It's a chronic illness and it needs a chronicity of visits, building that relationship.
Yeah, you mentioned not necessarily doing it in that first consult, but being aware of it in every consult, or trying down the track if
That's
you're not
right.
winning with someone.
That's right.
Yeah.
And being upfront with it, as the results come in, saying, look, they're not looking so good. I wonder if I'm not giving you the correct advice, or my explanation is not good enough. So that the literacy, the education, the income levels are low, because that's the evidence. Lower socioeconomic associated with poorer health outcomes, and that's where this person is coming from. So trying to do more than just the transactional relationship in that consultation will actually reap us as a country better rewards.
And if you feel like you aren't winning, what help could you get out there? Are you able to sort of find things that can help you assist in getting to know someone better, or having better quality consultations with someone?
Very much. Fortunately for us as a country, we have started to recognize this.
Yeah.
So a lot of DHBs, even PHOs, have community health workers who may be Pacific, may even speak the language, or have a better relationship and time, have more time than us. And I want to emphasize, it's still important for you as the clinician to build the relationship. So the way I do it is I send out the community health worker to bring them in. I still want to build a relationship. There's I think we get into difficulties if we try to get the community health worker to be delivering the messages. But if they see that you are concerned enough to get someone to come in and bring them in, whether it's smoking, whether it's about diabetes control or their blood pressure, it's part of that building relationship. But help is out there.
Thank you, Api. I think that's a really important message, and hopefully people will take home some things that they can immediately start doing.
Thanks very much, Helen. Thank you.
Thank you.